So James, tell us about your organisation and who you work for.
I'm the Father Frank Flynn Fellow at Menzies School of Health Research, which is an alcohol harm minimisation focused role.
Yeah, and why are you interested in this project about young Aboriginal males and health literacy?
I've had a long-standing interest, I guess, in men's health across Australia, and what we know is that young Indigenous men are particularly vulnerable, that they have particularly poor health and high-risk taking behaviours. So when the opportunity came up to do a small research grant in this area through the Lowitja Institute, we pulled together a team of people from across the Northern Territory to start to think about how can we address this issue, and the general consensus was that we needed to be engaging young men in a discussion around their health and well-being. So that's really the focus of this project, is to try and find out what is important to them in terms of their health and well-being, and how that relates to their identity as a young man, so how it relates to masculinity, but also how it relates to their cultural connection to land and country and their people in the Northern Territory.
Yeah, right. And also, why do you think health literacy among young Aboriginal males is important? I think
So as I outlined before, I think it's really important that we understand the different needs of young Aboriginal and Torres Strait Islander males in terms of their health and wellbeing. And we actually don't know a lot about this space, other than what we do know is a deficit discourse. It's around what they do wrong, or how poor they're actually doing. So we're keen to try and flip that on its head and have a more strengths-based narrative around what's important to them and why. And we think that that has potential to be able to improve policy and practice outcomes for them over the longer term.
Great. And also, what other implications do you think this project might have for policy and practice in the NT?
Yeah, I think because we're working closely with policymakers and practitioners, either working in men's health or health promotion spaces within the Northern Territory, we think that there's huge potential to actually start to influence the policy agenda around what gets funded in this space and why. Certainly they're in the same position where there's not a strong evidence base around what works and what doesn't, and this particular project will go a small way in contributing towards better understanding that, so that they can make better policy, better evidence-informed decisions in their work.